As a heart surgeon, I'm warning you today about something that almost no one talks about. Yet millions of seniors take it every single day without realizing the hidden danger. A pill so common, you probably have it sitting in your medicine cabinet right now. This pill is marketed as helpful, sometimes even essential, but new research and decades of medical experience have revealed a shocking truth. This common pill can silently weaken senior hearts, raise the risk of heart failure, and accelerate aging in ways you never imagined. Stay with me because in the next few minutes I'm going to break this down in detail, explain the science behind it, and most importantly show you what safer options exist that actually protect your heart instead of harming it. Before we dive deep, I want you to do something important. If you care about your heart health and want to stay updated with real science-backed information that doctors usually don't reveal on TV or in commercials, hit that subscribe button right now. And leave me a quick comment below saying "Heart Strong." I read every single comment, and your engagement helps this life-saving message reach more seniors just like you. Now let me start with the shocking part. In my career as a heart surgeon, I've seen hundreds of cases where a patient's heart muscle was gradually weakening, their energy declining, their shortness of breath getting worse, and yet their other test results looked fine. The culprit wasn't always diet, smoking, or genetics. In fact, many of these patients were faithfully following their doctor's orders and taking all their prescribed medications. But hidden in their prescription list was a common pill that has been linked again and again to worsening heart function, especially in older adults. And I'm not talking about some rare or exotic drug. This is a pill that millions take for everyday conditions like pain, inflammation, or even for colds and sleep. So what is it? Non-steroidal anti-inflammatory drugs, or NSAIDs, medications like ibuprofen, naproxen, and even some prescription-strength varieties. These pills are sold over the counter, advertised everywhere, and taken casually by seniors for arthritis, pain, headaches, or sore muscles. But here's what the drug companies don't emphasize. NSAIDs don't just reduce pain, they also constrict blood vessels, raise blood pressure, and put enormous stress on the kidneys. That combination is a disaster for aging hearts. Imagine your heart already working harder because of natural age-related changes. Now add a drug that increases fluid retention, raises blood pressure, and stiffens the arteries. It's like asking your heart to run a marathon with a weighted backpack strapped on. Over time, the heart muscle becomes weaker, leading to conditions like congestive heart failure, atrial fibrillation, and even sudden cardiac events. And this isn't just speculation. Numerous large studies have confirmed the risks. In fact, one major European study followed thousands of adults over the age of 60 and found that chronic NSAID use increased the risk of hospitalization for heart failure by nearly 20 to 25%. That means 1 in 4 heart failure hospitalizations among seniors could be linked to these supposedly safe pain pills. And yet, they are still recommended casually and sold without warning labels bold enough to scare people. That's why I'm sounding the alarm today. Now you might be wondering, "Doctor, what am I supposed to do? I can't live with arthritis pain or back pain without something to help me." That's a fair concern, and I want to give you real solutions, not just fear. The truth is, there are safer alternatives, both natural and prescription-based, that don't come with the same heart-damaging risks. But before I reveal those, let me explain exactly how NSAIDs hurt your body from the inside. When you take an NSAID, it blocks an enzyme called COX, or cyclooxygenase. This enzyme is responsible for producing certain chemicals in your body called prostaglandins. Now, prostaglandins do cause pain and inflammation, yes, but they also protect your stomach lining, support kidney function, and regulate blood flow in your heart. When you block them, you not only reduce pain, you also reduce protection. Your stomach lining becomes vulnerable to ulcers, your kidneys struggle to manage fluids, and your heart faces added stress. This is why so many seniors taking NSAIDs end up not only with heart problems, but also with bleeding ulcers and kidney damage. Here's something even scarier. Many seniors take NSAIDs together with blood pressure medication, or diuretics, or even blood thinners. This combination is what I call a triple threat. The NSAID raises blood pressure. The blood pressure pill struggles to control it, and the diuretic or blood thinner increases the risk of kidney injury or bleeding. I've seen patients in my hospital who thought they were being careful with their medications, but the combination created a perfect storm that landed them in the emergency room. Let me share a story. One of my patients, a 72-year-old retired teacher, came in with shortness of breath, swelling in her ankles, and fatigue so severe she couldn't walk across her living room. She had no history of major heart attacks, but when we dug into her medication list, we saw she had been taking ibuprofen daily for over 5 years for arthritis pain. Slowly, this common pill had caused her heart muscle to weaken until she developed heart failure. After stopping the NSAIDs, adjusting her treatment, and switching her to safer alternatives, her condition improved dramatically. But imagine how much better her quality of life would have been if she had known the risks years earlier. Now I know many of you watching are probably thinking, but doctor, I take Tylenol, am I safe? Acetaminophen, or paracetamol, is a different category. It doesn't carry the same level of cardiovascular risk as NSAIDs, but it does come with its own dangers, especially liver damage if overused. That's why no pill should be taken casually, especially by seniors. The safest pain management strategy is always a combination of lifestyle changes, physical therapy, diet, and carefully monitored medication, not just popping pills every day. So what are the safer alternatives? First, topical treatments, gels, creams, and patches can often relieve arthritis pain without the systemic risks of oral NSAIDs. Second, certain natural anti-inflammatories like turmeric, omega-3 fatty acids, and ginger have been shown in clinical trials to reduce pain and inflammation without harming the heart. Third, prescription medications like low-dose colchicine or certain non-NSAID pain relievers can sometimes be a safer option under doctor supervision. And finally, non-drug strategies like targeted exercise, water therapy, and even acupuncture are backed by research for improving mobility and reducing pain. Here is the bottom line. You must weigh the short-term benefit of pain relief against the long-term risk of heart damage. Unfortunately, too many seniors don't even realize they are making that trade-off because no one has ever told them. That's why I am here, to put the truth in your hands so you can make an informed decision. I also want to emphasize something very important. Never stop any medication without talking to your doctor first. If you're currently taking NSAIDs, don't panic. Instead, schedule a conversation with your healthcare provider and ask about safer alternatives. Share what you've learned today. Most doctors will listen, especially if you show them the science. Now, before I continue deeper into the hidden effects, I want to pause and ask you something. Have you ever experienced side effects from common pain pills, things like stomach pain, swelling, or sudden fatigue? If yes, I want you to comment below with your experience. Your story could literally help another senior watching this video avoid a hospital visit. Plus, I personally read every comment, and your voices help me know which topics I should cover in future videos. So take a moment right now, scroll down, and leave a quick comment. It makes a huge difference. Let's go even deeper into the science for those who want the full picture. When NSAIDs reduce prostaglandins, they reduce nitric oxide availability in the blood vessels. Nitric oxide is the chemical that keeps your arteries flexible and open. Without enough nitric oxide, your arteries stiffen, blood pressure rises, and the risk of clots goes up. That's one reason why NSAID use is associated not only with heart failure, but also with strokes and heart attacks. Think about that. A pill meant to reduce pain in your knee could silently raise your risk of a brain or heart event. Another hidden danger is that seniors metabolize drugs differently. A 30-year-old might process ibuprofen in 6 hours, but a 70-year-old may take 12 hours or more, meaning the drug stays in the system longer, increasing side effects. Add on other medications, slower kidney function, and changes in body composition with age, and you have a recipe for toxicity even at standard doses. This is why the elderly are disproportionately harmed by medications considered safe for younger people. Now let me tie all this together for you. The common pill I've warned you about, NSAIDs, is everywhere, from your bathroom cabinet to the corner pharmacy. It provides quick relief, but silently weakens senior hearts over time. But you are not powerless. By understanding the risks, exploring safer alternatives, and working closely with your doctor, you can protect your heart while still managing pain effectively. And the more we spread this truth, the fewer seniors will suffer unnecessarily. If you found this information eye-opening, here's what I want you to do right now. Subscribe to this channel if you haven't already. I share new science-backed insights every single week that could literally save your life or the life of someone you love. Then comment below with the words, "Heart Strong," to let me know you recommitted to protecting your heart. And finally, share this video with at least one friend or family member who you know takes common pain pills. You could be the reason they avoid a devastating hospital visit. I'll end with this. Your heart is the engine of your life. Every beat is a gift, and every choice you make either strengthens that gift or weakens it. Don't let a common pill quietly rob you of your health and independence. Stay informed, stay strong, and I'll see you in the next video with more truth your heart deserves to know.